I used to listen to my Aunt Vicki, who always said, she's a dental hygienist, you know. And I thought that was such an important thing to be, and it is.
I wanted to do something where I would be working with people and wanting to do something for them, providing them with some sort of care. That's what drew me to dental hygiene.
My life was changing. I knew I needed to have a career that would help support me and my two sons.
U of M had a large research department, and I was really interested in research, and I knew at Michigan I could probably find that.
I remember it was the early 70s. They had just built the current structure of the dental school, and that was pretty exciting. We were in one of the first few classes that got to go through.
I remember my first day making friends, and everybody was just as excited as I was. Janet Kinney was a classmate of mine, and she was just as outstanding when she was a student as she is today.
Marker.
So remember when we practiced without gloves and safety goggles? I don't remember wearing safety goggles. Maybe some of my colleagues do, but the safety goggles is another layer. I remember always having to wear white dresses and of course the caps. We no longer wear caps. We for sure didn't wear head bonnets. I do remember cutting my hair. It was required that our hair not touch our neck, so I remember going to the beauty shop and saying it needs to be off my neck. Well, the mask, that was new. We didn't wear masks, but now don't we love being in N95s? And here's our very, very favorite, what we call the shower curtains. These are the gowns that we wear now during patient care.
The dental hygiene program here at the University of Michigan, it began in 1921. Dr. Hard took the lead in 1924 and was director of the dental hygiene program until 1968. Through her time frame, which was really legendary, she went from a one-year program to a two-year program. She implemented the baccalaureate degree, which then made the graduate of the dental hygiene program sort of on a par educationally. She initiated the graduate program in 1964. The students who graduated under her had the utmost respect for her. She was a demanding professor and expected the best out of her students, and I think got the best out of her students.
Vicki Tondrowski, my great aunt, graduated from the dental hygiene program in 1926 and then taught in the dental hygiene program from 1936 to 1969. She was obviously a great influence for me.
In 1968, Pauline Steele came to the university. Pauline came in already a leader in the field of dental hygiene nationally.
Miss Steele was a very proper woman, and she was absolutely wonderful. She had a heart of gold. And Karen Ridley could really teach those clinical skills.
Pauline Steele served as director for 20 years, retiring in 1988. I owe a lot of gratitude to both of them for having set the foundation of excellence when I became director of the dental hygiene program. In 2008, the online program for degree completion students was initiated.
The online program became so successful because Ann Gwazdeck and Wendy Kirschbaum had a vision that they worked really hard to realize.
We had about 18 months of doing all the background work on it, getting approval, developing the curriculum, and putting the first initial courses online, and then from there we kept building. So by 2012 then, we had enough under our belt with the degree completion program, we could take a turn and work on the online master's program. So that launched in 2012.
Freshman year that I was in the program, we had a guest speaker, and that guest speaker was Miss Janet Kinney.
In 2012, I retired and Janet Kinney became the director of the dental hygiene program and is the director today.
I think about that 100 years and how we've changed and how we've grown, and the students that now come into the program and what they want to use their dental hygiene degree to take them into their future, whether it be an advanced degree or whether they wish to stay in clinical practice. Those are our accomplishments.
We've grown, you know, the profession of dental hygiene, the profession of dentistry has just grown exponentially.
Our student profile has changed over the years. We have commuters, we have moms, we have dads, we have second career students, we have students who already have a bachelor degree that are looking for a major career change.
All the faculty members, the staff members, everyone I interacted with really helped support me. I felt very supported, really helped mentor me, and I feel mentorship is so important.
We were taught that this is not the end of the road for your education. This is only the beginning.
That's important, that we continue that community that we've built with our students as they graduate and become alumni.
When you keep those connections with your colleagues, with your professional colleagues, and they become personal connections with those colleagues, it's amazing. Dental hygiene has been a wonderful career for me. I've loved every minute of it.
I've been able to teach, I've been able to be involved in my professional association, I've been able to be a researcher and work in public health. And it's through these connections that I've had at U of M that have allowed me to expand in my career.
Celebrating our 100th year anniversary since the inception of dental hygiene at the University of Michigan, I think represents not just longevity, but the ability to actually thrive.
My biggest goal for the division is that we continue to provide cutting-edge, evidence-based education and training for our students so that they're prepared to enter into the marketplace in the world and be the best oral health care providers they can be.
I believe there is just no better program in the country. They continue to be the innovators.
And looking at what our alumni have done. Our graduates have gone into so many different directions and represented the university again throughout the world.
The fact that we have remained and sustained our program for now over 100 years is something to truly celebrate. So congratulations to everyone over all those years that have made the dental hygiene program the success that it's been.